scenario is an elderly person who's been fairly sedentary, who has several risk factors or pre-existing heart disease, such as prior heart attack, prior strokes, coronary bypass surgery, prior coronary stents, or prior angioplasty. So these are high-risk categories. Also, patients with obesity, diabetes, who are fairly sedentary, hypertension, high cholesterol, stacking up all these risk factors. Often these folk are not accustomed to strenuous activity or regular exercise. And then when a snowstorm comes along or an ice storm, and they feel like they have to step out to shovel snow, that's a very strenuous activity. It is mostly upper body, which is much more demanding on the heart, using arms a lot, lifting a lot. And on top of that, the cold air that they inhale induces spasm of the arteries, and more specifically, we're talking about the coronary arteries. So having coronary spasm in such a situation cuts off the blood supply to the heart, and that's sort of why we see a surge in heart attacks and arrhythmias and sudden death, and specifically associated with shoveling snow. And more specifically in the South, we're not accustomed to having this kind of cold weather, and we're not as adapted to this cold. So when you have, I think it would be amplified. You'd see more of an effect down here with these kind of conditions. So they would be the typical symptoms. Most notably would be angina or chest discomfort associated with activity when you have less oxygen coming to the heart. So angina is felt as a left-sided or a central chest pressure or tightness or squeezing. Sometimes it's felt in the jaw or even in the teeth. Sometimes it radiates down the left arm or both arms. Sometimes you feel it radiate to the back between the shoulder blades. So everybody's a little different in terms of how they feel it, but that would be one of the hallmark symptoms. That would be a very dire warning that something's wrong. Sometimes it wouldn't be angina; it would be more like what we call an angina equivalent. So that would be extreme breathlessness. Just you start doing the work and you just can't get enough air, or maybe palpitations, lightheadedness, feeling like you're going to pass out. All of these would be hallmark symptoms of cardiovascular disease or cardiovascular crisis while shoveling snow or exposing oneself to cold weather. Advisory that came out from the American Heart Association, I think in the last couple of days. And first of all, they encourage people who have pre-existing cardiovascular disease, the categories that I mentioned earlier, to try to avoid shoveling snow and avoid the activity altogether if at all possible, and have somebody else do it. They also included people who have risk factors, who have no known prior heart disease. So people who are overweight or obese, who have diabetes, who have hypertension, high cholesterol, all of these individuals should be, and also on top of that, not accustomed to regular exercise or activity, to try to avoid this scenario. But if one has no choice and has to go out there and shovel snow, maybe to clear a driveway or something, that it needs to be done, then their recommendations were firstly to dress extremely warmly, have several layers down on, also to cover the nose and the mouth so that you don't inhale the cold air, to try to do more of a pushing away snow rather than a lifting, that would be less strenuous. If at all possible, use a snow blower, which is way less strenuous. And most of all, most importantly, pay attention to symptoms. If in any way an individual starts to feel any of those symptoms we talked about earlier, they should immediately stop what they're doing and get inside and rest. And if within the next 5 to 10 minutes the symptoms don't resolve, don't abate, have a low threshold to just go ahead and call 911. If the symptoms persist, certainly beyond 10 minutes, one should just go ahead and call 911. So that, I think it was a very well written, succinct set of guidelines for dealing with this kind of weather, and in the context of cardiovascular disease. Be aware, be mindful, and have a low threshold to call for help if there's a crisis.